Bruce Williamson here with world-renowned physical therapist Edmond Yana. Edmond, tell us a little bit about yourself.
Well, as you know, I'm a physical therapist. Name's Edmond Yana. 44 years old, born and raised in Brooklyn, New York. Have a wife and 2 kids, Michael and Ashley.
Okay, so first, describe what a physical therapist does.
Physical therapist is just a different type of doctor. Deals specifically with sport or injuries and rehab of those injuries. I personally deal with sports and athletes and helping to rehabilitate the athletes.
Okay, so are you allowed to prescribe drugs to your patients?
I personally am because I have my doctorate's degree. If you just have a bachelor's degree or associate's degree, you're not allowed to prescribe.
Okay, so what type of schooling does one need to have to become a physical therapist such like yourself?
Well, first you need to go to your 4-year school, just a basic university, and get your degree there, and then follow up at a graduate program, which the hard thing is most of those are on the East Coast. There's a few in Oregon and I believe one up in Washington, but mostly they're on the East Coast.
Okay. So after you finish up with your schooling, what comes next?
Well, you got to take some licensing exams to get your doctor's license, and so you can work. And then after that, you can either open up your own clinic or go work for a hospital. I personally work in my own clinic just because it makes more money, and I like the fact that I'm in charge of people and I make things go. Whereas in a hospital, you're kind of working under people and you're not a boss, I guess you could say.
Okay, so what is the salary for a physical therapist? Is there a broad range or is it just set in stone?
After about 3 or 4 years of experience, it ranges from about $50,000 to $65,000 a year, and then after that, depending on if you have your own clinic or not, you can get upwards to $125,000, $150,000 a year.
Okay, so what's a typical day like for you? Just walk us through your typical day.
Well, first I get up in the morning, stroll into work, make sure everything's getting started off right. See my patients if I have to, and then make sure all the other doctors that I work with are same, seeing their patients, getting everything worked through. And then head home, eat dinner, hang out with the fam.
Alright, so who makes a good candidate for the job?
A good candidate would be someone that can work well with their hands, a hard worker, someone who wants to stick to it and get through all those years of school for the benefits that are going to pay off.